let's talk about these booster shots. A lot of people feel like it's more clear, and more people seem to have more questions. So I guess, when we take a look, all right, now we've got options. How do you decide what you should be doing when it comes to booster shots?
Well, what we know now, and what we've known, frankly, for a long time, is that because of the Delta variant, because of this highly contagious variant that is infecting more and more people because it's so transmissible, we're seeing that a small subset of the population who has been fully vaccinated are at particular risk for severe consequences of COVID-19. So, severe COVID, where they need hospital care, and tragically, where some patients have died. And so we've been able to identify what cohort of patients are at particularly high risk for breakthrough infections. And those are the very patients who should get a booster shot. Those are people over 65, and those are people who are immune compromised, which we knew back in August, those people were eligible for a third dose. And people who are between age 50 and 64 who have underlying health conditions or institutional risks, like healthcare providers, teachers, people who are faced with coronavirus more often than others. So it's been very confusing for the general public to follow all of this data. At the end of the day, it's a very broad framework that the CDC has given. So the hardest part of my job as a primary care doctor right now is explaining to people why they don't need a booster shot, because a lot of people don't fall into that category. And they're like, why should I not get it if it seems to boost my antibody levels? And the truth is, at the end of the day, these vaccines, whether it's Moderna or Pfizer, and a little bit less J&J, that's why everyone who's had J&J likely needs a booster shot, they're continuing to be extraordinarily effective against the endpoints we care about, which is severe COVID and death.